For those of you that don't already know, I became a chiropractor for a very obvious reason. And the very obvious reason is that I am very bad at drawing. However, basically what we have here is our rib cage. So a concept I wanted to basically talk to you about is not actually anything to do with the rib cage. It's actually to do with what we find underneath it. So with modern society, with how much we sit, with how much we stress ourselves out, with all of the things that are going on around us, our exercise routines, we forget about one of probably the most important muscles within our body system, which is both a conscious and subconscious muscle, which basically means that it is both under our control and not under our control. So it works both automatically, but when you really think about it, you can actually control it. Now, interestingly, some of you may have already worked out what muscle I'm about to talk about, but for many of you, you possibly haven't even really thought about this muscle actually being something that can create a problem, and it is something called the diaphragm. Now, for many of you that don't already know, the diaphragm is our breathe muscle, which essentially sits along this bottom edge of the rib cage here. Now, the purpose of this muscle is essentially to draw down and push up. And essentially what it works is like a syringe. It pulls the air in, creates a lower air pressure, so the air moves into our lungs and then forces back up again. And again, just like almost compressing the paper bag back out again, therefore forcing the air back out of the lungs. Now, interestingly enough, if you think about it, when we all sit with our forward head postures or compressing our rib cage, what do you think we actually do to the diaphragm? Now, the other thing is as well is that because it's both a conscious and subconscious muscle, this is a muscle that has been linked very heavily to emotional dysfunction. E.g., if you become stressed, think about what happens to your breathing rate. Now, that being said, if we're in a chronic state of stress or a chronic change in our posture or a chronic lifestyle change where it involves sitting a lot, this muscle can get very drastically affected. Now, there are some very simple techniques that we can use in order to actually, one, release the muscle, but two, actually learn to control our breathing, which will both help us emotionally, it will help the muscle to relax, but it will actually help increase physiologically how much air and stuff that we can get into our lungs if we can learn how to use the diaphragm as opposed to all the muscles that sit in between the ribs and the muscles in the neck. Because yes, you guessed it, when you're not using your diaphragm properly, we start to create compensations. And as a result, that's when we can start to see pain, dysfunction, and problems start to occur. So what I would suggest is do your absolute best. Let's release this. Let's learn how to work with this properly so we don't have these problems in the future.
So the first exercise that we're going to have a look at is a diaphragm release. So all you need for this exercise is basically the ball and something heavier that you can use almost as a lever to push into the ball. So what you're going to do is place the ball directly under the ribs. You want to do this with your knees bent so that your abdomen is more relaxed. The ball is just going to sit just underneath the ribs, and actually you're going to place the weight on top, and you're going to use that weight to essentially pull it towards you. And you can actually look at working different angles. So as you can see, my hands are moving around a little bit just to be able to find the different positions where we can find any tension on the diaphragm. Now the diaphragm has two halves. You obviously go underneath the left and the right hand side, and you're going to be really looking for any tender spots. Now, it's really important to remember with a diaphragm release to try and breathe and actually take a nice deep breath in, and then all the way on the way out, that's when you're going to apply the pressure in. So you actually almost want to draw in slightly more as you let that breath all the way out. So you can see there that we just took that breath all the way out, and then we just drive in a little bit. So we're going to take a little breath in all the way out, and we're just going to pull in a little bit more. So as you can see now from the side, you can actually see that ball sinking underneath my ribs and up towards my diaphragm. So I've showed it just on the right hand side here, but you can do it both on the right and the left. So the next thing that we're going to have a little look at is diaphragmatic breathing. So when we look at breathing with the diaphragm, where we should essentially move is with our stomach and not with our chest. So all we need to do is take one hand on our chest and one on our tummy and just take nice deep breaths in. Now what you should feel is that all of the movement is with the hand, like you can see here. So the bottom hand is the only one that should move. The top hand should stay completely still. And you can work this as many times as you want. You'll actually find it's also really, really relaxing. So the next one, again, we're going to look at really opening up those ribs. So we're going to do a deep breath and lift. So essentially with the lift with the hands, we're essentially allowing that first rib and the clavicle to raise up. We're actually allowing a little bit more rib flare laterally. So that first one, we were really looking at pulling the diaphragm down. Now we're really looking at utilizing those ribs. So as you lift the hands up, you take a nice deep breath all the way in. And as the hands lower back down again, you're going to let that breath go all the way back out again. Again, you can practice this as many times as you want. You'll find that it's also very relaxing. Then this final one is really about getting that upper back and those ribs moving. So with restrictions in the diaphragm, quite often the reason being is that we've got problems or spasm in one of the rib heads. So actually by getting into this position and just doing some rotations through the upper part of the back, you'll find that you start to release those ribs and just allowing a little bit more room for those lungs to move, making it a little bit easier for your diaphragm. You may also find with this exercise that you'll actually get a couple of pops and clicks either in the lower back or the mid back. Now for this one, we're obviously aiming to get most of our movement through the rib cage. Again, it's really important that you do both sides to try and keep everything nice and even. You may find that one side is slightly more rigid than the other, so you want to focus a tiny bit more attention on that side. You may just choose to do a couple of extra repetitions. And that's going to be it for all our exercises today.